Welcome, everyone, to this week's ECV Ask an Expert talk. I am joined today by our resident data scientist and website engineer, Derek Van Genep. We have Stephanie Bilodeau and Gary Chisever. Wave to the camera, boys. You're live. So this week's topic is how to win our the ECV strategy for overcoming COVID and the discussion of that strategy, sort of thinking of it as a multi-pronged approach to ending COVID. Instead of this is the holy grail solution, we need to bring all the solutions together and actually drive the virus to extinction in the population. So I will quickly list off the nine parts of our plan as is on the website, and then we'll begin discussion. Get everyone on board. That's number 1. 2, lockdowns. 3, travel restrictions. 4, isolation. 5, masks. 6, wear masks in shared space. It doesn't necessarily mean mask at all time. If you're outdoors and you're by yourself in the open air and the breeze and the sun, breathe the fresh air. That's really great for your mental health, right? But when you're around other people, when you're indoors, wear a mask, keep yourself and other people safe. Number 6 is essential services should be safe. Number 7 is testing. This is really how we're going to overcome the virus. Health guidelines, so people know what to do to stay as healthy and safe as possible in daily life. And number 9, support medical care so that people can get treatment and we can all get through this together. All right, so those are kind of the 9 parts of this. Do any of you guys have something you'd like to jump on in at, or should we just start at everyone on board?
I have 3 more to add to those 9. One is
Go ahead.
Contact tracing, which fits in with a test, trace, isolate. Ventilation might be nice too. And my last one is don't go back to school.
All right, so ventilation as in more airflow is good, right? Yeah. So if you're indoors, windows open, fan blowing, all that kind of stuff that just disperses is going to be productive by reducing the viral load in close quarters. But it's just, that's the basic idea there. Good points, Derek. So sort of with get everyone on board, I think that, this is perhaps an obvious concept, but it's important to maybe explain a little bit of the game theory involved and the way that unfolding human interactions give us a bad outcome if we're not all on board defeating the disease. And so if everybody is on board defeating the disease, we're in it together. We're all on the same page and we're all working together to fight the disease. The disease is beaten at the margins. The difference between a growing pandemic and a declining pandemic is the difference between 1 and 0.99. That's the difference. Now, to really maximize the difference, you want to get that 0.99 below, as far as you can get it. The lower you get it, the shorter the lockdown, the shorter the pandemic, the sooner we can all get back to the economy. If we try to push through the pandemic, what we end up with is the worst situation, which is where some people are taking risks, spreading the virus, spreading harm. Nobody trusts each other because they don't know if they have the virus or not. So it makes it very difficult to have healthy human interactions if we don't have the trust that is built from knowing that the other person around you doesn't have an infection. And taking the risk of getting that infection is like, there's lots of harm that comes with that. People die. That is the obvious harm that we always discuss that in like wild detail, but also people get sick. Getting sick, that means months out of work for many people. Many people have long COVID. It lasts for like terrifying amounts of time where you're completely debilitated. That's loss of people in the economy who can't work anymore if they're so debilitated. That's a cost to the entire economy, taking care of those people. There are huge costs at the game theoretic level of interactions where people are avoiding interactions to avoid risk of getting sick, and also to do the moral good thing for society, which is to beat off the pandemic so we can get back to like living life instead of this continuous lockdown. And so that's like the basic argument for get on it board. If we actually fight the virus, it can be over. If we don't, we're stuck in no man's land.
Gio, if I may, I would like to add a bit on that.
Go ahead, Stefan.
In the same direction, in fact. So we all need to understand that this pandemic is like a fire, a huge fire. So for you on the West Coast, you know what's a huge fire for sure. And in like in any fire, there you would see, and firefighters know that. So there is a fire triangle. So you need oxygen, you need heat, you need fuel. And the first spark. So here, the first spark was definitely when there was the first transmission from animal to man, etc. So that was the initial spark. But we, the humans, us, in fact, we are the fuel in this battle, this fire. The heat, indeed, is generated by the virus itself. So it is a very infectious virus. So it's generating a lot of heat, if I simplify it. But the oxygen, and that's the key thing I want to outline here, is the oxygen is given by our interactions, and that's the point you were highlighting earlier. So these interactions might take three forms essentially. So specifically for this virus, so you definitely have the droplets we're talking about extensively. So when you're talking, when you're coughing, you're generating droplets, and that's a direct contact and interaction between two humans. You have the fomite, so you can have the surfaces which are in fact just are the yes, and washing is exactly for this reason, so you need to do that. And then you have a third one, it's the aerosol, and that's a new one essentially, not that much present in other types of virus, but, and it has happened in other, but in this very pandemic, it has been a huge question from the beginning. So that's the third big interactions, and we definitely see that more and more since we have new situations coming in. So school reopening, big events with a lot of persons and stuff like that in confined space. So you have another type of interaction, which is not a direct between two humans. It might be minutes, if not more, after someone is passed into a space or a room. And we just saw this week a new report on a Starbucks in South Korea, where people got infected just by being in the same room, even if they were far away, because of the air conditioning system mixing these aerosol inside the room. So this is the fire triangle of the pandemic, and we have a huge generation of oxygen, and this is because of us. So that's for the first point you were highlighting. That's why we need to get everyone on board. So each and every individual might be the source that will be, in fact, transferred through the others through the interactions. So everybody needs to be on board.
Definitely love the analogy, Stefan. It's a very good one. That's a great background, Gary. All right, so lockdown. This one has been like talked about at just about every angle, and so the core idea of the lockdown has been a bit missed in implementation. I think I would say, and this is maybe a little bit extreme of a way to say it, but it's the way that I've felt about it from the beginning, is that in the US and in a lot of other places, we've watched what feel like cargo cult lockdowns. We have word that means lockdown and things that happen, but they aren't fully scientific, they aren't fully thought out, and they aren't fully implemented. We have the illusion of a lockdown, and a real lockdown is not more repressive and anti-freedom than what we're going through and what we have been going through for the past 6 months. It is instead something that is very careful and intentional and can be done to maximize freedom while reducing COVID exposure. And instead, we've kind of had a wishy-washy approach. And this has caused us far, far more loss of freedom across time. 6 months of really not being able to be normal humans in day-to-day life is a far greater loss of freedom than to do an effective lockdown that we're all on board for over the course of, say, 6 to 8 weeks to fully crush the virus. And so, we can go into how like a proper implementation would be different in ways that are more humane in considering our human lives, and also more effective at overcoming the virus. And so I guess I'll open it up to the panelists if we can start to bring in some of the elements that would make this more effective. I think the obvious first one is to get very serious about testing, because that's how you find where the virus is and take care of it. And then the second piece that's really important with that is isolation. That means isolation away from other people so that the spread is stopped. If you isolate around other people, if you are isolated, that's the right word. If you are isolated around other people, then the virus will spread. You need, like we need as a society to be having places people can go where they aren't spreading infection to their loved ones, for example, if they're doing careful isolation. That's vitally important to stopping the spread of the virus. And we haven't really done this stuff effectively in our process. Instead, we really give people the terrible choice of living at home and risking all of their family and friends either to not be able to live at home with them, or to get sick while taking care of them, or to have to spend money to stay somewhere else and cause even more hurt to many of us, if not all of us, who are economically hurting during this time. Stefan, you may have wanted to say something a moment ago, or did I?
I can just add, but I don't know if Gary or Derek would like to add. But just want to say that effectively testing is a key item here, because if we don't have proper testing, it's really difficult to take the proper decision. So public health authorities rely on information, on data. So testing is the core of the data set that they're working with. And if they don't have this data set, if they don't know what they're what they're fighting against, it's really difficult to take the proper measures. And by the way, that was seen in the field in many jurisdictions in the last 4, 5, 6 months, essentially, for two reasons. One of the reasons is the fact that the coronavirus was not well known, and that's normal. It's a really new virus. And this virus has specifics which are sometimes much different than other types of virus in the same category, even compared with other coronavirus. This SARS-CoV-2 has its own specifics. But just taking this out, in fact, so the lack of knowledge on the virus itself, the lack of testing was giving a lot of trouble, because that led to not knowing the level of transmission in the community, and that's a key item to take decisions. You were talking about lockdown, we were talking about travel restrictions. All these are relevant if there is, or there are contamination, potential for contamination. But if you don't know, sometimes you take no decisions and you let the virus come in. It's true that the precaution principle should have led many of the jurisdictions to decide upfront and protect upfront and take decisions directly from the start. But anyway, we all have seen what had happened. So hopefully this is a lessons learned for many countries and states. But we'll see. That was I talked too much. Sorry for that.
No, we're all welcome to speak. Yeah, the precautionary principle, avoid massive risks and, make smart decisions. Good principle. Derek.
I was thinking we should sort of linger on lockdowns a little bit, just to sort of discuss, I don't know, the trade-offs or like how to do it correctly or something like that. So I think there are a few countries that are good examples and a few countries that are bad examples. There's a lot of people out there that say like lockdowns don't work because some countries have tried them and they still have COVID. But there are some counter examples, like China, for example, did like a really severe lockdown and contained the virus very quickly in a way that most countries wouldn't be fine with. Like the steps that they took, where they were like sometimes like pulling people out of their homes if they tested positive or something, that just wouldn't fly in most countries. But New Zealand also locked down, contained the virus, opened it up carefully, and they're doing very well. Israel locked down, contained the virus really well, and opened up and lost everything. US lockdown, sort of. Same thing with Europe. Much of Europe locked down and didn't really do it well enough to get down to a really small amount of transmission and to keep it low. So most of Europe is climbing back up, and US already had its sort of second wave, and maybe there's another one happening. But yeah, I think my main point is bad lockdowns don't work and good lockdowns seem to work.
Yeah, and there's South Korea, which unlike New Zealand isn't an island. There's Germany, which is doing pretty decently well from like the last I checked. I don't watch the country by country data nearly as closely as you do, Derek. So feel free to correct me or if I'm wrong, or to add some more examples. There is definitely evidence that there are places where lockdowns have worked from a broad range of lockdown strategies. It's not that there's one way to do it, which is like the China way to do it. There are a plurality of ways to do lockdowns. The important key is that the goal of the lockdown is the elimination of the virus and not just the slowing of spread. And that means that you have to take the lockdown and add like quality to it until it overcomes the virus. And then like kind of on the other end of lockdown, so you don't have like this permanent aggressive lockdown. Once you have the virus extinct in an area, not like slowing down to a trickle, but extinct, that area can resume to normal with testing to make sure that the virus hasn't appeared again, right? And then when it does appear, you do a very aggressive contact tracing, get specific with quarantining areas where the virus is spreading. You can do micro lockdowns. You don't have to do this, all the way lockdown, but you have to watch the edges of that specific place. But then as places start to open up, the places that are open can resume interactions at near normal. And the places that don't can still do travel restrictions with quarantines and like highly tested quarantines to maintain safety of the lockdown and the safe reopening. So you can actually have almost the entire economy back while the virus is still spreading in many places, which is actually far better than what we have now for everybody involved.
Yeah, and I think one big question now is like, I mean, many of us are in North America. Like, should the U.S. lock down and try to contain the virus? And it's a good question. Gary, do you have thoughts on lockdowns?
Okay, so there's top-down and bottom-up lockdowns. And sitting in my community, it's a top-down lockdown isn't going to happen. We might as well say, well, why don't we wait for a perfect vaccine? So, which somewhat relates to Tracy's question. Travel restrictions, repeating the theory of the metaphor of the firefighting. And while we don't love partial lockdowns, and we recognize that those take much longer, am I sharing anything useful here? Like states, I hope?
Yeah.
So this is as of August 18th in the United States, states that had some form of travel restrictions. Now, is that a lockdown? Definitely not. Is it a mild partial lockdown? Can it slow virus and it can be something of a fire break? I mean, many of the things that we're talking about here tonight are essentially fire breaks. Testing is a way of knowing where the fire is, so you can do some fire breaks. Tracing is a way of figuring out, and I've got another diagram I'll put up in a minute, just of the transmission network, person to person. But any way we can put fire breaks between an infected person and a non-infected person, that's how we contain the fire and eventually let it dwindle out. And hopefully that eventually doesn't take long. The better we do at that, the faster the fire is extinguished. So these are states as of August 18th that have some form of travel restriction. And when we compare that to our states that are doing well, it is an interesting overlap. It's not a perfect correlation. Is it still sharing?
Yeah.
Yeah. But there is some crude correlation, which I thought was sort of interesting. And you could argue that several ways. Even if it's correlation, it's not necessarily causation, but at least it shows that folks that have somewhat got their curves under control want to keep it that way and are at least doing something in that direction. Bottom up, all of us need to minimize our non-essential travel, our mixing in the population. Let's see if I can get this. I'm going to stop sharing for a second and hit on the, try and get another picture up just to talk about the fire break concept for a second, if I can get this screen working.
Gary, I've never seen somebody with so many tabs open.
No, it just is what it is. Here we go. And I don't think I'm still screen sharing, am I? Okay. Now I got to get back to where I can do that. Let's see. There, nobody has to see the pain of those screens. So this is how the fire spreads. What was it? Tinder, kindling, fuel, spark moves from here on to the next tinder. We want to, let's see, somewhere here there's a way to annotate, and it'll take me 20 minutes, so I'll spare everyone that while I try and figure out how to do that. But if you all can see my arrow, my cursor there. So if we can identify quickly who's infected, we can put a break here. We dig our fire break here. If we get it a little later, but we do some tracing, we still put our fire break here, and we spare cases. And if we do isolation, so that, now I think the way they drew this one, this is a child, we're not gonna, we just don't go there. We're not taking kids out of their households, but we are gonna protect the parents with some PPE or whatever it takes to essentially put a realistic fire break that works based on family. But if it was this person, maybe we provide a way for a week or two for them to be out of that setting so that this person, and everyone else in the household don't get infected. We need to build those fire breaks. Getting back to lockdowns and travel restriction, whether it's bottom up, all of us voluntarily doing what we can to minimize mixing, bunch all these people in this diagram together, and you get much faster spread of the fire. Have less interaction. No parties at night, no COVID parties. Whatever it takes to minimize the interaction to a minimum, then we're building fire breaks and we're stopping the spread. Whether we can do it in the 2, 3, 5 weeks, I think we've seen in the 4 months since that paper was originally written, the all-in idea has to somewhat change to as many in as we can get to participate, and that gets faster eradication. Eradication is still the goal. I think the last 4 months have shown that the idea of all in, or as Tracy puts out, there isn't every place that can really do a pretty solid lockdown, in which case the testing, tracing, and isolation strategies are vital, particularly with the widespread tracing. I think that's probably enough for me for a bit. I'm going to stop sharing here. Thanks.
Yeah, Gary, I think you made a good point. Like, if you can't lock down, okay, well, do your best and, you know, reduce R some other way. Stefan, you got any?
Yes, I like the analogy with fire breaks, which is continuing to talk about the firefighting things. Definitely, that's the thing to do. And I personally, but that's just my personal opinion, it would be difficult to lock down a huge country like the USA in one shot. So definitely, it needs to be coming down to communities and stuff like that. So small fire breaks. The important thing, by the way, is to be able to determine where the outbreaks are. So that's why it's coming back to testing. So without testing, it's like trying to extinguish a fire, being blind and not knowing where the fire is. So you go with your fire truck, you cannot drive with blind, but anyway, you understand what I mean. So the fact is, if you don't know where the fire is, you will not be able to, or where the fire is going, you cannot place any brakes. So that's absolutely important for this second strategy to be operational, since the full lockdown might be difficult. So it's like a partial lockdown, well placed, that could do the job. But it's absolutely, and it's really an absolute here important thing to have proper testing. Without proper testing, it's like driving blind. So that's absolutely, you'll go in the ditch for sure. So, and it's it's a compromise to the full lockdown, but it's the only way to have this compromise efficient. And that, anyway, that's just my take, as I said, but definitely data is showing that. So the countries, by the way, the countries which are able to succeed typically with, even with some partial lockdown in some countries in Europe, they succeeded because they had in place proper contact tracing, proper testing, and all the tools to be able to take the good decisions. Without that, it's, as I said, driving more.
Briggs here, if it's okay for me to jump in. For me, I feel that some of these action items are kind of getting a little jumbled together. And through my outreach work, they've kind of been clarified into 3 categories. And one of them is like the general community. That's the everyone on board, social distancing, wearing masks, and even lockdowns kind of gets plumped in there. It's kind of a fading term, in my opinion, for the USA context. We still talk about shutting down certain sectors, like entertainment sectors or gyms, for instance. But we're not really around a community lockdown, but that's part of everyone on board, education. Okay, that's how the community gets treated. Then there's the conversation about sick people or potentially sick people, and that's the testing, trace, isolate component of the action steps. And then the travel restrictions is its own big umbrella, kind of separate. So I'd like to just bring that distinction here between lockdowns and travel restrictions as I've understood them. In the travel restrictions is really like an outlook for your community, either containing it locally or continuing to keep it out of your community ongoing. And there are these other sub bullet points, including essential workers, safe institutions. I like that Derek said about ventilation, like starting to look at technical adaptations we can make to our spaces. So just jumping in there, because it seemed like some of these items are kind of getting jumbled together, but they're kind of different subsections of the conversation.
There's probably different ways to look at this. Personally, from my point of view, travel restrictions are a modified form of lockdown at different scales. You can have an individual minimizing their mixing in the population, or you can have a state that minimizes its mixing with other states. It's still essentially the same thing. And a lockdown from the top is a regulatory imposed limitation of individual or travel in a community, and a travel restriction is that at the state level. So I think there's different ways to look at it.
Yeah. Yeah. Thanks, Briggs, for the categorization. Would you want to kind of write that up in the chat so we have it kind of like visualized for us? I think that might be helpful. I did a quick version of it, so there's something to copy paste with. But yeah, that is sort of having a framework for this is definitely good because it is a lot to think about. So we'll roll on here. I think we've kind of covered isolation to some degree, and the need to do it in a way that's like healthy for people, that doesn't like cause them to harm their family by infecting their family, and doesn't cause them to go into debt and stuff like this. That's sort of supporting isolation instead of like forcing isolation, I think is kind of the right way to conceptualize that, which can be like, renting out a hotel, which, might not be getting a lot of traffic, and using that as impromptu isolation ward. Same with like schools that aren't in use. There's lots of buildings that can be effectively transformed into an isolation ward that can be sort of far better for society than just someone wagging a finger at you and telling you to stay home, regardless of your personal circumstances. So wear masks in shared space, I think, is an important discussion because there's so much noise on this and so much like narrative that get pushed around it. And so I think that this is one to go into in a little bit more detail. Gary, you're the medical expert, so I'd like to call on you to maybe explain a bit about transmission and mechanisms and all that.
Well, I think it was Stefan who talked about the three basic, the fomite surface transmission,
Mm-hmm.
and the what we call droplet transmission, and the aerosols. And that aerosol versus droplet is getting a lot of play and press and in the popular social media right now. I just had Jeremy Rossman, our virologist that often participates in these panels. He and I were just re-updating each other today on that we're pretty much in agreement that that's essentially a spectrum, and we don't really know yet the size of the infectious particles. So I tend to lump aerosol and droplet together in the sense that the evidence is this can spread more broadly than that 6 feet, but it's still a sort of radius of contact probability thing, that the further you are away, the more ventilation, the less crowded people, and the less virus that's being dispersed in the environment, the less chance you're going to get infected, whether it's a droplet or an aerosol. I could go on for hours about convection currents and things like that, and how that impacts aerosols and these tiny particles and where they'll float. It's neat stuff. I'll spare everyone that. The masks seem to cut down a lot of transmission, and there's plenty of data at all levels, whether it's using mechanical models that create artificial droplets to simulate virus, whether it's laser created video that show when we cough or even just in normal breathing or when we sing, how the mask really contains that and reduces the amount of spread. So it really controls the radius at which we're projecting these things. And then the epidemiologic data seems to correlate with that if we wear masks, we prevent a lot of transmission. Some of the classic situations that I look at were those two hairdressers in Missouri who worked for several days while they were each symptomatic, and there were no infections traced to that. But then there's a well-known incident in a hotel in Switzerland where they used visors rather than masks. And I don't recall the number of infections that it caused, but it essentially became a super spreader event. And as best we can tell, that's an example of how if you contain the spread with a mask and you avoid crowded, close contact conditions, then you don't get the transmission. You can dilute the viral load in the area. And the mask is a huge part of that, very important part of that containment. And that's true whether it's a fabric mask or an N95 mask. There may be some incremental benefit to the N95s, but a good fabric mask can go a long way to really cutting down transmission and become another effective form of a fire break.
I think the one thing to talk about on this is to just think about what a mask is instead of trying to say these are the facts of masks in like some kind of data science way. Because the evidence is very clear on this that masks stop particles. But if you think about it, a mask is a type of barrier. You project particles out, some of those particles hit the mask and stick to the mask and therefore don't go into the air. That's like the basic version of how a mask works when you're projecting outwards.
There may be a little more to it. And
no, there's definitely more to it. I don't want to like oversimplify to the point, but I was going to continue a little bit and then I'll let you kind of bring in more detail.
Well, and also hopefully bring in Derek and Stefan, but I want to lead into it if I can. So.
Oh, sure. So that's like the most simple concept. Anything that catches the virus that isn't somebody else or a surface that somebody else is going to touch is going to reduce the amount of virus that's going somewhere. And that's one of the huge benefits of like just a mask. And pretty much anything is going to disrupt the projection of particles, and that's going to be a benefit. Even a mask that is loose fitting is going to have some of that benefit. There's a spectrum, like tight fitting N95 has a powerful filter, fits around your face tightly. That is, going to reduce all of the viral spread better than, something that's cloth and around your face. But all of these, the broad amount of this range has benefit. For self-protection, the same applies, but it's less complete. Like an N95 is a very high level of reduction of the amount of particles that end up in your body, and a cloth mask is going to protect less than that. And the thing is that one virus doesn't infect you. It's getting a viral load high enough that your body's automatic defenses can't fight it off, and you build up to an infection, and your body has to go to war with the virus. And so the idea is to reduce the load. It's not a binary between zero virus possible hazmat suit and you're going to be infected. It's more a probabilistic range. And then Stefan?
You're right. The mask has an impact on the viral load that someone will get. But I just want to highlight that the very first use of a mask is to protect the people that are in front of you. So you are protecting them by using a mask. But yes, you're right. There is a counterpart, which is a positive counterpart for the user of the mask. There are more and more studies showing that it's reducing potential viral load coming in to your mouth, nose, etc. So that's a secondary effect, which is a positive effect for the user of the mask. But the mask is always a tool which is towards the other, I would say. So it's helping the other. So it's the fire breaks that we were talking earlier. But in fact, it's a fire break which is helping the user as well. So that's good. But it's really important for people to understand that they're still the fuel of this fire. So we are the coal block of the fire. So the mask is just taking one coal portion of your of this fire. So it's reducing the risk for this fire to grow. But at the same time, you're right. Viral load is one secondary effect. Reducing viral load is one secondary effect. It has been more and more proven in studies, but it's still an ongoing science, I would say. But it's always affected by the size. Gary just pointed out a couple minutes ago, the size of the droplets versus the aerosol. So depending on where you are in this continuum of size, this effect of reducing the viral load is more or less important. So this is impacted by the type of mask you're using. So if you have an N95, the impact is bigger than if you have a homemade facial mask indeed. But all masks are helping. Okay. First, as I said, to block the spread towards others, and second, reducing the impact on yourself.
Gary, did you want to, or Dark, go ahead.
Yeah, I'll just point out one thing. I've never met an anti-masker, like somebody who thinks that masks don't work and that we shouldn't use them. I've never met one that understands like either basic, science or medicine. And I think they really do, or they really have the potential to do a fair amount of harm by spreading those ideas. And I think the CDC we could probably include in that, especially early on when they said, don't wear masks.
It's kind of this scary dysfunction of game theory trying to push us to just accept the pain instead of actually solving the problem, and it's a little bit sad and painful to watch. But we are continuing to make progress with the virus, and the science on this is very clear. So it is kind of knowledge. So essential services should be safe. This is very important to, the same rules of interaction, like human interaction, reducing the risk for people so that while we are in the pandemic, the economy can be as healthy as possible. Everything that adds risk to the pandemic makes the pandemic worse. Risks making the pandemic worse. Risk infecting individuals around you, or risks infecting yourself, adds to the economic cost that comes from the pandemic. The economic cost does not come from the lockdown. The economic cost comes from the virus making it so that human interaction is expensive. And by this, I mean, if you shake hands with somebody and you get sick, that costs you and the economy and society all of the time that you would be able to work, that you're unable to work because you were sick, all the time and money and effort that is required to take care of you while you are sick that you could otherwise use to take care of yourself, and also all the medical expense of going through the treatment process, and then all the future economic damage that is caused by being harmed by the virus. The virus has done permanent trauma to people. It has done stuff that is tragically going to very likely haunt them for the rest of their lives. Maybe it's to a small degree and they'll get better over time. Maybe it is something that really is going to last a lifetime. That's a horrible tragedy. And that is part of the economic cost that comes from the pandemic that has nothing to do with how we as a society have reacted to the virus. It has everything to do with what the virus does to us and us figuring out how to avoid the damage that is done. We can't just accept the damage that is done by the virus, because that is the worst possible outcome. There is no worse outcome than just letting this happen all the way through. It does the maximum amount of long-term damage. So that's, to have a functional economy while we are going through this process, essential services need to be safe. That is the best trade-off that we have available to us. Do any of you guys want to add to that line of thinking?
Yeah, I'd like to make sort of one point is there are a couple of different strategies that different countries are going through when it comes to COVID. And the one that ECV pushes for is typically called containment or elimination, but it essentially means we want to get rid of community transmission and then keep the virus out as well as we can. It's also called the hammer and dance by Tomas Pueyo, famous Medium article. But there are a couple of other ones. There's sort of mitigation, and then there's going all the way to herd immunity threshold. And I think many of our we've been calling them actions to win. Many of our things have overlap. Like in every one of these scenarios, there are some of these things that you'd want to do. And I think Stefan has been pointing out for months now that probably one of the most important ones is protecting your high-risk institutions. If you want to minimize deaths, then that's super important. I think for the US, Stefan might know the number better than me, but something like 40% of our deaths have been in high-risk institutions. And I think like long-term care institutions are probably one of the major contributors to that. So yeah, and I think things like masks, things like isolating people away from home so they don't infect their family members. I think there's a lot of overlap, and most countries would agree on most of these points, but I don't know if that, it seems often that people think there are these things that we'd have to do for containment and there are these things that we'd have to do for mitigation, and there's not a lot of overlap, but I think most of it is overlap.
If I could, I'll just talk on herd immunity for 1 second since it was mentioned. So the herd immunity folks, who generally we're not too sure about, but the concept of fire break is right in there. The only problem is they're building a fire break out of gasoline because this doesn't work. But they're in alignment in the sense that we're all trying to build a fire break. But it's just there's this little gap here because they're using flammable material for their fire break.
Well, I think it's more that they're using burned out forest for their fire break. They're starting a fire to create a fire break. And the problem with that is that they don't have other fire breaks in place. And so they're just starting fires. And, that's not helpful. Trying to fight a forest fire by starting fires isn't particularly helpful. This is, a point about forest fires is that letting a forest become so susceptible to fire is a real problem. Like, our forest fires are getting worse and worse because our actual forests aren't getting cleared out. And the same kind of conception can be applied to society, but it's applied not at the level of herd immunity, but the level of preparing society for pandemics. And part of preparing society for pandemics is environmental technology, like, the plexiglass barriers that you walk through, having stocks of masks. We didn't have these supplies at the start because our risk management is very screwed up. Our theories of it are very broken. And that is strongly evidenced by the way that this pandemic has played out. This is something we need cultural and systemic change on, is to care for these systemic risks. But and then the other bit of it is having healthier people. Like the less healthy that we are as a society, as individual humans, the more susceptible we are to future pandemics, the more susceptible we are to all sorts of future harms. So building, health is important part of that style of fire break thinking, whereas herd immunity is just starting fires.
Well, and as Derek said, then whether we go for eradication or mitigation, most of the steps would be similar. It's how aggressive and how many steps you apply and what your end goal is. And in contrast, then, to herd immunity as it was attempted, which was do none of that, and as you say, build your fire breaks out of flammable, fan the fire instead of trying to fight it.
If I may, I would add a bit on that. So just to confirm first that, Derek, you were right. So in the US, it's about 40% of the cases, not more, the deaths, which are related to high-risk institutions. And to continue on what Gary said, so herd immunity, which is what they tried in Sweden, and I still say try because they still continue to try it. But anyway, what has been the consequence of that, it's amongst the worst cases, the worst countries in terms of the number of deaths in high-risk institutions, such as long-term care. It's even worse than the 40% we were talking for the USA, so in Sweden. So they sacrificed a portion of their vulnerable population to try the collective immunity or the herd immunity, and without really knowing what the virus was made of, I would say. So this virus, is it really possible to have a long-term immunity? No one knows even now. So there are some trends in the science right now which are coming up, but still definitely not known in March, and still it's an ongoing discussions among scientists. So so that's the risk you're taking trying to use this fire break, being the herd immunity, is that the payment will be made by the vulnerable in the society, and that's what's happening right now in Sweden. And it's the same thing for having missed some important measures, lockdown, which were done or not, wearing masks, and I'm talking here not necessarily a mandate for wearing masks, but the population voluntarily wearing masks, so deciding to wear masks rather than just waiting for the government to decide. So there are a lot of studies on that front. So some countries where it was a kind of no-brainer to use masks without waiting for the government to ask for it, and others which have waited for these measures, and you see the impact on many of these the countries, on the results, I would say. So the population is the fuel, as Gary just repeated. It's absolutely the key thing. So whether your public health authorities are asking for things or not, in fact, it's almost secondary. The first thing is each and every individual need to do the proper thing, whether it's isolation. If someone thinks he might be at risk, I would say, in isolation or quarantine, that's the only thing the person should do, even if the authorities are not asking for it, because that will affect his own community, his own family, his own caregivers. And I'm coming to your first point, Gio. So the best way to protect the essential workers or the caregivers and support medical care, it's to make sure that you don't add outbreaks into the communities. You're not the cause of a new outbreak. So that's the very first way to protect the medical system, the medical workers, and the other essential workers. It's to just limit these outbreaks, and each individual has an impact on that because of the fact that we're just a part of the coal. We're the fuel. So just taking one part and another one, this fire will die. So that's the virus needs us. So if we give us our availability to we're flesh and blood for the virus, it just needs that. So we just need to be put in front of another and we'll do the job for him, for it, I should say. But the fact is, we definitely, each and every person needs to understand that. And then you can have your government, you can have your public health saying this is to be done, this needs not to be done. Fine. but each person is important here.
All right. I guess going into testing, I think that that one. So we all know the concept of testing. You go, you do a saliva swab, you do a nasal swab, you spit into a cup, whatever the retrieval process is. The test is done, and you get back a result, positive or negative. Some of the issues with tests is that tests have reliability thresholds. It's like it's really not you are positive, you are negative. It's like you are 80% likely to be positive given the reliability of this test, or you are 80% probability of being negative given the reliability of this test. And so a negative test does not mean you do not have a coronavirus. It means that it's very unlikely that you have coronavirus based on the probability of the test. And so it's not a, hey, I tested negative, therefore I don't have to worry about the safety of others. It's, hey, I tested negative, I don't have to shift to isolation. And I can continue to live normal processed life with everyone else. And if we get really reliable tests and we use them often, we can get far closer to not having to worry about the spread risk of the virus, because the tests will make it very unlikely, like beyond even the probability of the test, because of the level of the disease being able to be repressed and eradicated. So if we get really serious testing, we can get back to normal even while we still, or maybe not normal is not quite the right word, but we can return to life instead of like this continuous dragging on, if just by having enough testing for all of us to be very confident that we are not at like full risk when we're having interactions. We're at a reduction of full risk that's some level below it based on interactive probability that, you could explain the, intricacies of how the probability connects. But basically, if we have really good testing, we're less likely to be able to infect each other because we're less likely to have the virus. But it's not a binary of you had the test, therefore you were fully safe. It's you had the test, you were mostly safe, and then as you build that out, you're mostly safe to mostly safe to mostly safe to fully safe over time.
So exactly, and expanding on the points that Derek added earlier to our 9 points or how to win, particularly if you have the tracing and isolating also in that component. And again, just re-emphasizing our concept of fire break with the isolation. And so what happens is with no measures, you get a compound or a multiplicative spread. You get a chain reaction that's exponential. With a lot of testing, and particularly once you add isolating and tracing to it, now you get a multiplicative benefit and you quickly bring your R naught down to 0, or your R effective down to 0.
Yeah, really important to understand that testing gets us safer, back to normal faster. And the way that works is by using tests, you can build more safety, but you can't go from test to fully safe because the tests aren't perfectly reliable. And none of the tests are so reliable that you can really pretend that there's no tail, because the percentage variables of spread, it's such a fine line between eradicating the virus and having a steady state of the virus that you want to get every sliver of that line down as much as possible. So I guess health guidelines is the next topic. I'm not as well informed on this as I would like. I can say like the generic stuff, but I'd rather defer to Gary, Derek, and Stefan on this completely. So I guess Gary, you are the medical expert, so I'll go with you first.
Well, I'll hit that quickly, but I think when that was written 4 months ago, there was more of a vacuum of information, and now there's less of a vacuum and more of a flood. Uh, the um, obviously good health, and at that time, I think when that was written, more people were in a full, not a full, but at least mandated quotes lockdown state, as opposed to personal restrictions of non-essential travel, which I think several people have pointed out. Maybe it's not useful to call that a variation of a lockdown, but call it sort of some very degree of self-isolation, or just attempting to minimize your mixing in the population. While doing that, you want to practice good self-care. And a good part of that was pointing out, and I think it was in those guidelines, fresh air is good. Minimizing your mixing with the population, minimizing your risky exposures to others, does not mean you can't go out into a park or take a walk in the woods. And anything that helps keep you healthy and close to some healthy routine is a good thing. That's about all I got. I certainly defer to Stefan and Derek on that.
I guess a few of the things that I've heard, which correctly if I'm misinformed on this, because it really isn't my strong place, is the regular things that you do to be healthy. So exercise, just build up like your overall like physical endurance. That stuff's good for you. Being outside in the fresh air, reducing your stress load, listening to bird song, vitamin D, that is all really important stuff for your human well-being. And your human well-being really applies to the virus. If you're very stressed out and you get infected, your body is not in a good place to begin the fight against the virus. And so you'll start, fighting the virus at a disadvantage if you are very stressed out, if you're like, very depressed, if you don't have time outside. This is, it's not, like great to be extremely isolated. This is why doing it fast is, again, better than just letting the pandemic drag on. Because letting the pandemic drag on and like run its course to herd immunity means we spend more time in this stressed out state of the virus, which means we're doing more stress damage to our bodies. Our bodies are less able to fight the virus. So we're actually getting worse outcomes by being in this state of pandemic longer. That is, actually like part of the dynamic. But, that eating healthy food, having a functional social life, which doesn't necessarily mean face-to-face interactions, but can be online interactions. It can be waving at your neighbor, like building social connections in your community with a safe distance is probably going to be very, very healthy and helpful, and will help the like rebuild process when we're finally done with this. If we're more connected locally to each other, we'll have a better ability to economically recover. And building those connections during the pandemic is probably a very good thing. That is something that we should think about as part of this, and that's part of health and being healthier. And those are the things that, right off the top of my head, make a lot of sense in health guidelines territory.
I
Stefan?
think you're right. Well-being is probably the key word here. So that's what's to be taken care of by everybody, because there is definitely a stress caused by the situation, and not only just the pandemic itself, but also the consequences of the pandemic. So whether it's on the work side, whether it's on family, whether it's whatever. So this is certainly something that needs to be done. And Gary highlighted that going outside is certainly a good way. For different people, there might be different ways to do it. Always thinking of these restrictions that we all need to take into account related to physical distancing and stuff like that. But as soon as it's typically outside, this is a virus which has much more difficulties to transmit itself outside than inside. So that is more and more proven. So going outside is certainly, when possible, certainly of the easy trick. But taking care in general of your well-being, of your mental health, making sure that you, even if it's like we are doing right now, video conferencing or others, or exchanging with families like that, it's absolutely important. But I'm not a specialist in psychology, so I will not go further than that, but that is really, really well known. It's important to take care of it. And there are other things, Gio, you mentioned maybe vitamin D and other things which have been identified as potential helpers, I would say. Definitely not absolute, but definitely not going in the good direction, not in the opposite side. So anyway, on the health side. So there are all those things on that. So this is, so well-being, as you mentioned, is a key thing. So take care of yours and the one of your relatives, your family, your community. So that's also important. So it's a kind of two-way street. Even as I said, thinking of the restrictions, but thinking of that, but there are ways to take care of your relatives and your family and being still safe. So that's probably the thing to do in the situation.
Right. So we've got support medical care, which is another one that I'm not as well equipped to talk about. So I'd like to give it to one of you to open on. I guess Gary, as resident doctor, do you want to take this one?
Only if Stefan or Derek don't. I'll let them start. Or no. Stefan? Derek nodded no.
You want me to start on that point? Effectively, Gary, you're the guy for this portion. But
Right.
the only
Well,
thing I would add right now, just to start, and then you'll be okay to continue, is for us all to help support medical care. I think, and it's what I said earlier, we need to be part of the job to cut the transmission. So making sure that the health system is not overwhelmed. So in turn, that will help every workers in the health. So that's my take. So I'll let you talk about the medical side of it for sure.
Well, no, I think that's an important side of it. I'm looking at that sort of three ways. One is our own responsibilities, both to ourselves for all kinds of selfish reasons, but also, even things like getting a flu shot, so that's one set of problems that the healthcare system doesn't have to deal with, while it's still dealing with some very difficult situations and spots related to COVID. And of course, the chance that we could easily have a recurrence of a Northern Italy type situation or a North Jersey, New York kind of situation where pretty advanced healthcare systems were really, really in serious trouble, or as unfortunately long-term care facilities still are in some places, in a lot of places. That's another part of the responsibility or reason why all of us have such, essentially, I can only speak to my own moral obligation. It's very hard to talk with, tell somebody else what they're, but like to myself, I feel part of my responsibility to prevent infection is to be one less burden on the healthcare system. So in that way, supporting the healthcare system. At the time that document was written, another way I think it was meant, which also still applies somewhat, but shortages of PPE and things like that, it's important that they do be preserved for the first responders and for people rendering care. Otherwise, hospitals and first response systems quickly become spreading sources of spread. And it's very important to keep that from happening. Now, the third way I think of that, which ties into that, is still people do need to take their other health problems seriously and address them, whether it's getting a flu shot, or if you're in the right age group and having symptoms and have risk factors, say, and you get chest pain, you can't not go to the ER because you're afraid of catching COVID. You should handle that the same as you would have before the pandemic, no worse and no less. So that's another way to support the healthcare system, by not waiting till problems are so bad that they're unsalvageable and further burden the healthcare system and your family in that way. that would be my take on that point at this time.
Right. Thanks, Gary. I think the one thing I would add on medical care is we have some heroes in these COVID times, and there's a lot of, I think, shallow talk about, like, our medical heroes and stuff. I want to say something a little bit deeper on this, which is these are the kind of people that we, like, the people who are fighting on the front lines each day in the hospitals, taking personal risk. These, like, the people who get COVID because they're fighting so hard to save lives, like, these are the people that we want to know about. Like, these are the people who have done something glorious in their lives, done something honorable in their lives. We need to recognize them and respect them, because they are, like, in some really deep sense, some of the best of us. And, like, this is something important about the honor of a society, that we take care of them for, like, this is the same with veterans, that we take care of them, that we recognize that they have done something great. And so if we have someone who's a medical care worker gets long COVID and, is suffering from that, we as a society need to absolutely take care of these people. Go ahead, Gary.
Well, just briefly, and it's their own personal risk, and it's either the sacrifice in isolating from their families, especially many did that to a great extent early on, but the families are still paying the families pay the price often, having been in healthcare for a long time. That price is often paid by the family, maybe more than even the provider. And also, speaking a little bit indirectly for the service people, possibly the best way we can honor those sacrifices is each doing our part to try and minimize spread.
Exactly right. So we've got contact tracing, which is one of the items that Derek added for us. So I think on contact tracing, there's a lot of concern about surveillance. And so the important point with that is that there are models for contact tracing that don't provide the kind of surveillance state effects that are scary. And so that, like, there are ways of doing this. Gary and your zero-based project that you were part of is one example, but there are definitely ways to do this. It's not a contact tracing and surveillance, it's contact tracing as a solution, and we need to use it, and we can choose the way of using it that works best for us in terms of our personal trait, our personal trade-offs between freedom and getting out of the pandemic. But the one option that is not really effective is no contact tracing, because that just gets, like, we still, like, really, when it comes to surveillance, we walk around everywhere we go with phones in our pockets. These contact tracing surveillance that you're going to get is trivial compared to, like, social media and GPS coordinates and just, like, internet life. And so the relatively small added burden of contact tracing to sort of surveillance risk, which can be mitigated with different contact tracing models that are, like, zero knowledge based. So they're mathematically based in zero knowledge systems, mathematical models. But even, like, the kind of, like, least privacy friendly version of contact tracing is as privacy friendly as daily life is right now. And maybe we need to have a talk about surveillance state and all this, but we can't have a functional society without getting rid of this virus. So if we're talking about this kind of stuff, we need it in a broader context. And we need to get to zero. If you're worried about authoritarianism, long-term pandemic is a really terrifying driver of authoritarian tendencies and social collapse. So you get both ends of the fear spectrum if the longer a pandemic rolls on, and the worse a pandemic gets, and the more screwed up mentally, screwed up socially we get across time. So that's my pitch for contact tracing. It's very important, very good. And it's something that's been around for a very long time, like far before computers. You could get called up and go through a story of events and connect to the people in those stories of events and the locations involved. Like, it's not conceptually scary. Derek, go ahead.
I have a request for Gary to describe zero base.
Definitely. Gary, floor is yours. Make the pitch.
All right, I'll keep that very tight as I can, since I know several people on this call have heard this many, many times. And also, I don't want to ignore the reinfection question, which immediately precedes it. All right, briefly, zero base in its default mode uses QR scans. So just by that action is an opt-in, because if a person doesn't want it known that they were at that particular point at that particular time, they don't have to scan. And they'll still get some protection through contact tracing for all the other places there that they've been when they do opt to scan. So in that way, it's selective and opt-in. Also, it turns out QR codes don't need an app to run. They can run in a browser, and that has some other digital implications for security. A lot of real-world applications, they still want to have a little bit of trade-off for the speed and convenience of notifications. So in those cases, we'll keep a phone number in a record. But in its most privacy preserving mode, which is an option for users, and they can still be notified, we tokenize the phone in a way that we can send a notification back to the phone of a potential exposure without knowing any details of that phone. We don't know, we have our sort of token ID, but it doesn't get associated in any way with a phone number, with a person's identity, or with any sort of serial number for that phone, the manufacturer's serial number or anything like that. And we use a crypto technique called zero-based knowledge of how you can query the phone to test for that token without compromising the security of the token and without gaining any other information about that phone than that phone, that token has association with the various touch points, with the various locations that it had been. And then our back-end computers know how to associate that with other tokens. So at its simplest implementation, we don't know who's been next to who. We only know which tokenized phone has had a risky exposure to which other tokenized phone. And those tokens are nothing more than tokens, and they don't map to anything else about the person. So that preserves privacy. And relative to what's called digital exhaust, the things like the GPS signal or our browsing habits or all those things that we emit all the time, or when we click like on Twitter or Facebook, we know just about zero about the person, even in the more opt-in modes where they've provided their phone number or that sort of thing. So that's a little bit about the contact tracing thing. Thank you.
Yeah, thanks, Gary. I tend to think of it as like it's safer from your back end because you've done it technically to be safe. But to somebody who doesn't believe you when you say that you've done it technically safe and doesn't want to do the research to understand the model, it is still as safe as visiting any web page on any website, probably even in safe mode, but I don't want to say it that way, but it's as safe as any of that. And it's just kind of like what you were saying about notifications. It's like your browser will give you a little pop-up, says, accept notifications from this. You click yes, and you've got notifications. like it's just like everything else, but you've gone the extra mile of designing it to be fully anonymous and secure from the back end forward. And so that, yeah, the contract tracing is like absolutely not something we should be having the goofy privacy arguments about, because it's completely backwards. Your phone's always connected to a cell tower. Everybody's like, that's constant knowledge of location. This is not like some kind of wild invasion of privacy compared with just digital exhaust, as you said. Guys, anyone else want to add?
Oh, Derek, you want to start something?
I was going to say 2 quick points. One is that if your tests don't get back within a reasonable amount of time, then contact tracing doesn't help very much. So they're sort of intertwined there. And then there's this other like really big misconception about if you have a lot of cases, then contact tracing doesn't work and you shouldn't do it, which is really surprising to me that that idea is around at all. I don't think it really has any grounds. Contact tracing efforts can be overwhelmed if you have a bunch of human contact tracers in many cases. And that's certainly the case, but they still help.
Yeah, there's really no coherent downside. It's sort of just built narratives, and it is kind of, we have the surveillance state problem, but contact tracing doesn't add to that. It is you know, sort of something that we could actually use as a reversal of that, but that's a long talk. Stefan.
Yes, it's going a bit in the same direction as Derek was mentioning, that for some, contact tracing doesn't worth it if we have too much cases. But that's, I would call that the traditional contact tracing, where you absolutely need one person making a phone call, which will take an hour or even more. So definitely, if you have 10,000 cases and you want to do contact tracing, you will need thousands of persons to be able to follow that, because each cases might have 10, 20, 50 other potential cases to test. So that's why you need to think about more on the other side of the fence, not the traditional or conventional way, but the IT way, the one Gary was explaining, and not only for this very pandemic. Contact tracing, for me, it's something that we'll need to learn to live with and to make sure that it's kept safe in terms of the information side. But it needs to be implemented, because this pandemic, in fact, we've missed the first few months with proper contact tracing in the Western countries, I would say. In Asia, they've succeeded in implementing it. Some, not necessarily the good way. Gio, you talked about the China way, which was a bit more stringent, and I'm saying it kindly. So it's not only they would take someone out of his home if it was contacted. Everybody's phone was under surveillance, and not only the citizen in China, but every visitors in China. All phones within the territory would be under. It's really surveillance more than just contact tracing. In fact, they followed you. So that's a bit different. So that's not what I'm talking here. It's really the I would say the safe contact tracing, numerical contact tracing, the zero-based type of things, which was well explained by Gary. But what I wanted to make as a point is, we'll need that for other epidemic that will be happening. Not necessarily, they will not necessarily become pandemic if we correctly address them really early in the process, and then contact tracing would help to avoid that. You know, the grandfather of SARS-CoV-2 is SARS-CoV-1, not necessarily grandfather, but there was another one in between, so that's why I'm talking about. It was contained. So SARS-CoV-1 in 2003, there was a substantial outbreak, but the reaction was different. Maybe the world was a bit more lucky at the time as well, but I will say that I think the medical system was able to contain it at the time. That was really not the case now. So we need solutions for the 2020 world in 21, 22, 23, because there would be other like that. It's a really big one, but definitely not the last one.
All right. So we've got ventilation, airflow good is kind of the basic one there. Do we want to go into more depth about airflow dynamics and droplets, Gary, or do you think we've probably covered this one enough and can get to the last item and all that? Yeah, okay.
Defer to the group. Happy to answer any questions if they come up after we. Yeah.
Sure. Yeah, that's probably a good way on this one. Airflow good is the summation of that. All right. So don't go back to school is kind of the last point on our list. So this one's probably a bit of a tough topic. And so I guess, yeah, there's a lot of ways to approach this. I think first and foremost, risking our children's health and long-term health for in-person education to just carry on the habit of education as usual, which we all know is kind of a bit of a mess. Just it's sort of just doing school out of habit, and that is probably not supremely optimal in this situation. But certainly just risking our children's health. And then the other thing that this is, it just amplifies the spread of the virus throughout society. More families are going to get infected, and then it's just going to hurt people, and it's not going to get us out of this pandemic sooner. It's not going to allow us, really to solve this problem. It's just going to cause the pandemic to drag on for longer and longer and longer. And then I guess that's really the core of it. We have been spending the past several months teleconferencing all day, every day. Like nearly every person has been using some kind of conferencing interface with the world. We can do that with school. It won't be perfect, but we're not going to radically miss out on education for the foreseeable future. But we can avoid so much of the risk by not having in-person school. I guess anyone have something to add to that?
I think the key here is really in person or on site, as the school is to be avoided. But I would just change the narrative here. It's not necessarily don't go back to school. It's not don't go back at the school. Okay, so that's different. We need to understand that we can have school in various ways. You highlighted, Gio, the video conferencing or others. I've seen other places which were giving, we're teaching outside when it's possible. Others would do some laboratory experiment with just a few person. That's possible probably to manage a bit more for some special cases. But we need to reinvent school for that period of time where we're not controlling the pandemic. So this is so it's why I would the number 12 in the list we have would just change it to we should reinvent school for the pandemic, for that time period. And anyway, some of the things that we'll be developing and implementing might last for a longer time period, but at least it will allow the spread of the virus just to reduce, because that's really school is a really important place in terms of the outbreaks, and we see it in the US, and we see that in Canada now. So every school that are reopening is a potential outbreak, absolutely. So that's it's every day you see popping new places for any reason. So it's absolutely difficult to control in the regular schooling approach. So that's what needs to be changing, how it's done, not necessarily the school itself.
I have just a couple of points here that, at least in the US, there are sort of very large misunderstandings about kids and school and COVID. One is, to us it's fairly obvious, but to a lot of the population, that they don't really understand that kids can get COVID and infect others, which is really fairly surprising that those ideas are out there. Kids tend to get less severe cases compared to adults, but even then, sometimes kids get really ill. And they certainly infect others. There's no question about that. And as for the US, school teachers, K through 12, about 25% of the teachers are in a high-risk category for COVID. And that's just like a disaster. You don't want to put somebody who's high risk in a classroom with like 20 kids, blowing their noses all day for 8 hours, 40 hours a week or whatever. It's not that long, but yeah. So I think, there are a lot of good reasons why kids should go back to school. And there are a lot of good reasons why kids really shouldn't go back to school in person. And you essentially have only, you have to choose between two fairly bad options. Like, at home schooling's not that great, but going to school is really not great either. So if you get rid of COVID, then you get rid of the problem and everything can go back to normal for the most part, which would really be nice. And, some countries are doing that. And I think my last point might be about college. College is probably one of the easier ones to just do online unless you have a lab. And college professors, I don't know what fraction of them are in a high-risk group, but I don't think that fraction is small. Almost every college professor I had was like well over 50 or 60. Yeah, I think maybe those are my points when it comes to school.
Yeah, this one's really hard and tragic, and is one of the things that we wouldn't be worrying about right now if we had been earlier on trying to do, real effective, COVID firefighting. This is only an issue because we've been, twiddling our thumbs, so to speak, on this for a long time, and so it's clear, like, even if we were following a Sweden style mitigation strategy, herd immunity, we would still be having all the problems of going back to school that we're discussing right now. Whereas if we had a fight COVID, put the fire out, get back to life, end the pandemic strategy, then this would not be something that we'd be worrying about right now. And I think that really states the case very strongly, is the lockdowns aren't causing all of the pain and the economic distress that we're having right now, because we're not really in lockdowns. We're kind of in lockdowns, but it's like this illusion of lockdown thing, this cargo cult lockdown thing that we have. What we're in is a pandemic. And we need to recognize that this is a pandemic. This is what a pandemic feels like. We haven't had a pandemic like that. We've really, like, this is a pandemic in my entire lifetime. I don't know about the rest of you, but I've never experienced anything at all approaching this. We've had, like, not pandemics, And we reacted to those and we're like, damn, this is bad. We should stop it. We stopped it. And, you know, we didn't have this that we're going through right now. And this time we were like, it's nothing, I guess, maybe it's bad. And well, this is what it is. It's not great. Pandemics are not fun. We should not be having, like, just letting pandemics burn through society. Because look at, you know, the decisions that we have to make if we don't get it under control. All right. I think that takes us to the end. If our panelists have something they would like to say, they're welcome. If the audience has questions, they're welcome to ask. I guess, you know, that's how to win. And, you know, a multi-pronged approach to defeating COVID that makes sense, and that if we, you know, got behind and we're working on it and made it happen, great stuff would be happening and the terrible stuff would not be happening. And, you know, that's kind of the, you know, the square for the circle. Let's see. Yes. Yeah, some, like, you know, some stuff with the school is we really don't want to be in the position where recommending, you know, alternatives to like being at school with classmates, with friends, in person, you know, learning. We do not want to be recommending, you know, the alternative for this. The alternative for this is really not, like, great, not being around friends as much. But this is a pandemic. Not recognizing the situation as a pandemic and trying to pretend that we aren't in a pandemic leads to just worse outcomes. It makes the pandemic longer. It makes so many people suffer, and it doesn't help anything. Derek?
I have a question for Gary and Stefan. Let's say you guys had a kid and that was, I don't know, 5th grade kid. What would you guys be doing right now in terms of school? Like homeschool pod, virtual school. Like, let's assume that, like, you're an average parent in the US or Canada, and you work a day job.
Great question, Derek. Gary?
Okay. Well, I was hunting for a picture of my 2 nephews sitting in their chairs, holding up their placards, who happen to be coincidentally 5th graders. They're twins, and very excited. The placards, first day of 5th grade, and it has the name of the school on it. It's in my Facebook somewhere. And I agree. And my sister actually is in the healthcare field, so she's not unsophisticated in this. They have opted to have the kids do, their school is all virtual now. And then if it were my kids, I would probably try and, Vincent is on the call. He did a beautiful job working on some recommendations for pods, or a model for pods of how to create that. If my kids are grown now, but if my kids were still school age, at 5th grade, I don't think I'd be sending them into the school here. Our school is doing a hybrid approach. I would keep them at home, and I would try and get them in some sort of pod then for some of the other, a limited pod, carefully selected. Thanks.
That's a tough question, Derek, because I'm really sympathizing with parents right now. I am a parent, but my son are older, so I don't have this very questions to respond right now, and that's not easy. For older children, teenager, for me, the pods or something like that, as it's or even just video conferencing, I think it would be the thing I would absolutely push my children being teenagers to do. For younger, that's a bit tougher for a question. And I think Tracy on the chat asked for the differences between the younger and the older on the susceptibility to get, but even more to transmit the virus. So below 10 years old, it's it's still unclear. Okay, so it looks like it would be smaller, the transmission from smaller children than from older than 10 years old. So there might be some places for younger children to do things, but the issue as of today, it's still an unknown. So that's there are trends in the different studies, but not yet confirmed. So this is still a risk. Definitely, it's to be put in a balance with many other things. So younger children needs to develop social skills and needs to be with others. It's why I differentiate the teenagers and the youngers. For me, that's two different things. And there is still some questions, but the fact is, on the pandemic side, that's a place which is at risk. Even if the youngers would transmit less the virus, it's still more important than many other common viruses. So that's on that front, purely epidemiologic side, this is the case. On the parent side, that's a tougher question. And one comment that I've seen as well is on the fact that schools, on top of being educating children, they are also there to report abuse, to make sure that some of them which are not able to eat have their breakfast every morning can have it, and other things like that. So there are other things, and that's a difficult parent and public health question. But as I said, different for primary school than secondary school. So that's where my line would be, even if my children would be still younger.
Thanks, Stefan. Yeah, so Gary,
Well, just quickly, and Derek had posted some. We're getting an increasing appreciation of this MIS-C, not to discount all the factors, the school lunches, the detection of abuse, the inequities of access. You know, not every family has high-speed internet and a bunch of headsets for the kids. But the potential downsides for the kids, even the younger ones, and that's aside from the issues of transmission to the adults and things like that. It's a sticky wicket. It's a tough set of issues.
I have another question for Gary and Stefan. So let's say your community had a very low level of transmission. Let's say it's essentially eliminated and your schools are opening up in person. What measures would you want for your kids' school to have in order for you to feel more safe in sending them back? So
I can start on it, since Gary, you started the preceding one. So definitely, if I would have, as I said, my children at the primary school, I would ask for ventilation, absolutely required. I would ask for masks for every children during, not only in the hallway or in the public space, but in the classroom. So I've seen some comments, it's difficult for children to put and take note. Yes, it might be, but children are used to learn things they don't know. So that's part of their day job, to learn things. And I think to learn to wear a mask is a good thing. So it might not be easy. It might be tough for teachers to control it, but that's the world we're in right now. But so mask for sure. Distancing, so small class in terms of number of person, even if they need to divide it in some in the morning, the others in the afternoon, and the rest of the school being remotely done. That you understand. So there's a mix of thing like that. So, but not a 30-person classroom regular with 30% in. So that's so physical distancing, mask, ventilation. That's for me 3 no-brainers that should be applied. And other things, so hand washing regularly, and making sure that when they go to the lunch during the lunchtime, they stay with their group and they're isolated from the other groups. So there are many other things like that, but the first 3 is the one I was mentioning.
That there's that case in Maine of the day camp that had no infection, or I think no infections or very few infections. It was an overnight camp. I said day camp, that was a mistake, but it was an overnight camp. And they did extensive things like what Stefan had just indicated. They cohorted the kids, so the kids that were in a cabin stayed together and did all their activities together. I believe there was aggressive disinfection of surfaces associated with the camp. They isolated all the parents and families, and the kids, when they came in, had to isolate for 2 weeks or something, or 10 days. They did aggressive isolation for incoming. I don't know that that has to be part of this theoretical community that we're putting kids back in school in, because you said you already had transmission down. There'd be a couple things I would add to Stefan's measures. One, I would hold a ceremony, and I wouldn't do it in the auditorium with the kids all sitting next to each other, but there'd be a video ceremony of burning a symbolic perfect attendance award. We can't do perfect attendance anymore to incentivize it. No, we got to rethink the culture that if you've got a sniffle or a sneeze, there's no shame in staying home. In fact, quite the opposite. And that has to become ingrained both in students and in staff. Along with that, symptom screening, hospitals are doing this. It's not unreasonable to ask some symptom screening as staff come in each day or periodically. But one way or another, you don't want people with symptoms of anything mixing in a group. Aggressive disinfection protocols, management of ventilation, spacing, limiting classroom capacities, all the basic measures that we've talked about. And then if I was on the school board, I'd be working with the town to maintain some surveillance one way or another, wastewater testing, aggressive testing through the town, to keep it that way, because you've got low transmission, but still in the setting, presumably, of an outside pandemic. And if I was on that school board, I don't want my school to be the random place that becomes the super spreader location where the community loses its status of having that low community transmission. So I'd be fighting that two-pronged. One is within the school, and two would be an outside linkage with the community to help keep it that way outside the school.
Right. Thanks, Gary. I really liked what you said about burning the perfect attendance award. That's, I think, a really powerful message for what we're going through right now. If we want to go back to school, which right now does not look like the best choice, because we need to just get this virus. But if we're doing this massive testing, maybe it's test the kids every day, every other day. We've got, new 15-minute tests with high accuracy, that are becoming available. We need to scale that. Like if we, do that and we just scale it, and we don't have this nonsense about only testing asymptomatic people as if that somehow is the solution to something. Like that's the nonsense knowledge. The real knowledge is who is infected, who has the virus, and who does not. The false knowledge is like, well, who is sick and sick with COVID? It's like, that's not particularly useful among all the things. That's just like a data point, but it's not any of the interesting data points to fight the virus. I mean, medically, like treating somebody, it's valuable to know what disease they have. But right now, most of the treatment technology that we have is to completely generic. It doesn't really matter if you have the flu or COVID. If you're sick in the hospital, you get treatment. There may be some detail, and we want to figure out what detail we can use to have more effective treatment. So we want to know who's infected in the hospital, but it doesn't actually solve anything. It doesn't provide us data about what's going on. It just provides narrative for sort of shouting at each other on Twitter, which is not a particularly effective use of science. So we should be doing massive testing to know who's infected so that they can isolate, so that we can stop the virus. We can do this at schools. We're not going to have perfect attendance, and we need to accept the reality of what a pandemic means for us when we're in society, which includes burning perfect attendance, because that is absolutely not something that is a functional incentive during the pandemic. It is pathological to try and force that upon children and families as an incentive structure. So yeah, thank you. Strong point, Gary. Go ahead.
It's interesting, and we never did, I don't think, hit the reinfection question, but there's another interesting one also from Anjum about the sleeping in masks. And I think the short answer to that is yes. As an intern, I probably slept through many cases while standing wearing a mask. I don't know. I don't think there'd be a problem with the kids doing it.
Especially like a cloth mask or a surgical mask or something. I mean, it would be tougher with like an N95, probably.
You want to be careful that there's no risk of strangulation. If it's, I wouldn't use ones that tie in the back. Ear loops would probably be okay. You never want anything around the neck that, if someone's asleep, you're responsible for kids. That's sort of a setup for a problem. But the ear loops, I think, would be all right. I don't think there's anything inherent about sleeping with a mask itself that, yeah.
All right. I believe that this is a good point to conclude for the night. Derek, you have something you'd like to say?
Yeah, I think we might have missed some questions, but maybe we could just do like rapid fire from the chat.
Sure. Yeah, that's a great idea. I didn't see them.
One was about the recent reinfection news that's coming out. So I think there have been now maybe 3 or so, unless there was a new one in the last day or 2, cases of confirmed reinfection with at least slightly different strains of SARS-CoV-2. And the question in the chat was like, what does that mean, like for all of this, essentially? And I think maybe Gary, you might be the best one to answer that question.
Well, I'm going to hit that one rapid fire along with Tracy B's question about the low cost, low accuracy saliva test. In my opinion, summary, too early to tell. I believe Belgium, Netherlands, and Hong Kong, I think, were the 3 locations where there were well-documented probable reinfections. I haven't seen anything new nor had a chance to go in detail over the 2 newest, were the Belgian and the Netherlands one. Could those still be outliers and something specific about those individuals? It could. Could it turn out that as we look more and get a chance to do more of that type surveillance and we get further into this pandemic, we find that that's not unique at all and that it's very much a real problem? Could be either one of those. The low accuracy, low cost test, they're just coming into play. So it's hard to say. We don't know the details of that accuracy. If those tests have systematic error where doing repeat tests over a period of time doesn't cancel out the errors, then we may be, even if it's a low money per each test, we could end up throwing away a lot of money to accomplish little. And the bigger problem is throwing away a lot of credibility of the testing procedure and having people think that they're protected when they're not. Again, too early to tell. I think a lot of that needs some further field validation. From what I've been seeing, I haven't found a lot of details yet. Thanks.
And for the reinfection thing, I think that maybe the 2 big questions are, can you become infectious again? And then the other one might be like, what are your odds of getting sick the second time around? And I think probably the answer to the first one is almost certainly you could be infectious again. And then the second one is, from what I understand, and Gary will correct me if I'm wrong about the medicine, is that your probability of becoming severely ill has been likely diminished for the average person. And yeah, but I think the probability of becoming ill again is not 0, and you can get this probably a compounding effect. If you get COVID once and you get some sort of organ damage, and then you get it again a couple months later, that's really not great.
And there are some allergic conditions where there actually becomes hypersensitization. So it could go either way. Most likely, my guess is that you're less prone to both getting infected and less prone to getting a severe infection. That, in other words, having had COVID once may be partially immunizing to the very least. But time will tell. And it could turn out to be one of these things where hypersensitization becomes an issue, in which case repeat infections could be more serious than initial infections.
I would just add that what it's telling us, and Gary is right, it's just the beginning of the studies on that front. It's now we know that it is possible. So it's no more impossible. So reinfection exists. If it's just marginal, we'll know. It's not yet defined. But this is no more an impossibility. This is existing. And the impact I would see right now is probably for those who are developing the vaccine. They now need to take into their sampling people which already have got the virus, because they might be also included in the potential future. So that's changing on the vaccine side, on top of all what has been said by Gary and Derek. So there is a third consequence of the reinfection is the development of the vaccine itself. The vaccines, I would say, because there were many on the table.
All right. Thanks all. Thank you, Derek, Stefan, and Gary for being our panelists for this week. I really appreciate it. This was a great talk. I think you guys all did a fantastic job. So thank you.
And you too, thanks for your moderation on that. It was great.
Thanks. I'm trying to do this right and to do it well. Anjum, thank you so much for being our back-end technical support. It's so appreciated. And thank you to the audience here. You had some good questions, and thank you for listening and going through this with us. And then thank you to all you out there on the internet for watching. Please, as they say, like, comment, and subscribe, and share this video if you find the knowledge in it valuable. We are here trying to save lives, make the world a better place, make the economy work again, and to get out of this pandemic, because that is the only way that life can get back and we can start healing as a society, as a species, as a planet from this pandemic and all the pain and economic damage that it has caused. So, that's it. Good night, all.